Hello to everyone, and then I am going to uh, start the program. So, welcome everybody. I come to you from Spokane, Washington, and I'm Dr. Amy Doneen, and I'm super thrilled that we're going to talk about women and heart health tonight. Okay, I will stop my camera and we will share. And off we go. Okay. Well, hello, everyone. It is February 12th, 2025, and this is our month to celebrate women and heart disease. So I have a hope and a dream, I guess. Over the next, Randy, I just want to be able to show my face so people know I'm talking here. I will turn this on. And then, sorry guys, little technical issues. And then minimize it. And share. Starting off with a bang here. There we go. Okay, I just wanted you guys to know that there was a live person here and that you could see me as we talk. It's easier. So throughout the next 45, 60 minutes or so, I'm going to ask you to do three things because there'll be a lot of information we're talking about, and sometimes it can be rather overwhelming. And I want to make sure that you leave with a tangible plan in hand. So, over the next few minutes to an hour that we're talking, I want you to just jot down three things that you find interesting. And then I want you to share those three things with three different people. Try to do that tonight and then over the next 3 days, because if we follow this rule of three, we'll remember things. And so then it becomes just a common conversation. So that's my hope. And I hope you find it interesting. So, what we're going to focus on today, we're going to talk about education. We're going to talk about awareness of heart disease. We're going to talk about action. What do we do? And we're going to talk about advocacy. It's important that we all become advocates, not only for ourselves, but for those around us, and especially in the world of heart disease in women. Why? Because the stats are not getting better. Heart attacks occur every 25 seconds. Matter of fact, every minute, someone we love in this country is dying from a heart attack. Strokes are no better. They occur about every 40 seconds. And for us as women, a scary fact is that almost 60% of stroke deaths are in women, whereas 40% of stroke deaths are in men. So women are particularly vulnerable to the effects of stroke, which obviously can claim our independence. So when I talk tonight about cardiovascular disease, I'm going to talk about those two somewhat synonymously, whether it be a heart attack or an ischemic stroke. So we will talk about those two conditions. So the first thing I want to bring up is, why isn't our current healthcare system, why aren't these statistics getting better? And I would humbly propose that the healthcare model that we all live in as healthcare consumers, it's a sick care model rather than a healthcare model. It was never designed, nor were our healthcare plans, by the way, to keep us healthy, but rather to fix us when we are sick. And that's oftentimes leading to this end stage disease management. We treat people after they're diabetic. We treat people after they've had a stroke or after they've had a heart attack. And we need to really flip that on its heels. It's got to change, because at the end of the day, what we all want is to live well, and we want to live independently. That's extremely important. And right now, there's about a 13-year age disparity between our health and our life. And oddly enough, when we look at those last 13 years, whenever they may be for all of us, our healthcare expenditures go up, whereas our quality of life goes down. And that just has got to change. None of us deserve to have that kind of outcome. So by doing prevention and acknowledging that heart disease and microvascular disease are the main cause of this disparity of 13 years, we can and need to do something about that. So we must stand in unity to advocate for one another. Education is the first step in this entire process. It truly is a time for change. Heart attack related hospitalization rates for women ages 35 to 54 has increased from 21% to 31%. We literally cannot wait any longer if we want to save those that we love and save ourselves along the way. So, how do we get better? Through education and awareness. Those are the first steps that we need to take. So, let's start there right now. Awareness, sadly, it's declining. When they've done surveys 10 years apart, 2009 and 2019 was the last time they took this data. And they asked women over the age of 25, hey, do you know that heart disease is your leading cause of death? And in 2009, 65% of women were aware that heart disease was our leading cause of death, whereas in 2019, that awareness has decreased down to 44%. Just terrible. And even more alarming, the greatest decline in awareness was among the most vulnerable Hispanic women, non Hispanic Black women, young women, and even women with high blood pressure. We must recognize the fact that heart disease is more deadly than any form of cancer, and quite honestly, all forms of cancer combined. 1 in 31 of us will die from breast cancer, whereas 1 of 3 of us will die of heart disease. This does not mean breast cancer is not important. It does not mean cancer isn't important. Matter of fact, there's so much synergy between heart disease and cancer because they're both driven by oxidative stress and inflammation. So as we diligently lower our inflammatory risk, increase our health, it's going to reduce cancer and it's going to reduce heart disease as well. So there's a lot of synergy in what we're talking about even tonight. So I encourage each of you to get educated. And here's some lovely resources for you. My colleague, Dr. Bradley Bale, and myself, along with our writer, Lisa Collier-Cool, have written two best-selling books, Beat the Heart Attack Gene and Healthy Heart, Healthy Brain, that are written for the public to sort of outline all this information so that you have a tangible resource in your hands. So please get those books and listen to them audio or read them, and I know that you'll be healthier for it. Okay, let's talk about awareness that we are unique and we are different. And in doing so, recognize the fact that our symptoms of heart disease are often much different than those of our male counterparts. 64% of women who die suddenly of a heart attack have no idea that they have heart disease. At the time of a heart attack, in addition to chest pain, women had a greater number of non-chest pain symptoms compared to men. These include things like nausea, heartburn, stomach pain, shortness of breath, and even unexplained anxiety or anxiety that's getting worse and worse and worse. So I always advocate, we tell ourselves and the people around us that if you feel differently than you ever have before, consider the plausible reality that it could be your heart. Get in and get checked out because women tend to present to the ER later because we're busy and we're thinking that we're all okay. And we really don't think it could be our heart. It couldn't be our heart. So by the time we present, oftentimes the damage to our heart is much greater. And there's all kinds of reasons for this, but we'll touch on some of those as we go through the next few minutes. Do you know that compared to men, women with diabetes have a 44% higher risk of heart attacks? Do you know that compared to men, women who smoke have a 25% higher risk of heart attacks than men? Did you know that women who experience intimate partner violence and domestic abuse have a 44% increased risk of heart attacks? Also, women who live alone report greater barriers to care, such as greater financial issues, isolation, and decreased access to care. So let's shatter these statistics through awareness and advocacy. You ready? Okay. Let's talk awareness and literally uncover some of the common red flags that place us as women at higher risk to develop heart disease throughout our lifetime. Because what we realize, if I told you earlier that 64% of women who have a heart attack have no idea that they're walking around with heart disease, and probably a higher number of these women did not know that some of the disease states that we live with, like autoimmune conditions, migraine headaches, gestational diabetes, all of these things that we experience throughout our lifetime give us a clue as if we are, or give us a clue to our risk of heart disease later in our life. So let's look at a few of these red flags as we migrate from childhood through our elderly time span and see what sort of red flags pop up that we can think a little bit differently about our demands from our healthcare system to say, I need to be checked out because I have X, Y, or Z. So let's look at those. There's a few that are really easy. Like this is a fun one. It's called Frank's sign. And if you look right where that arrow is pointed, right here, right there where that arrow is pointed in the middle of the screen, that's called Frank's sign, and it's a diagonal earlobe crease. And why it's related to heart attacks, none of us know. And it's a great red flag because it means if you fix it, doesn't mean that risk is going to go away. It's really telling us that there's probably a very strong genetic component in that individual's family of heart disease. So if you have a Frank sign, this diagonal crease in your earlobe, you have about a 78% increased risk of developing heart disease in your lifetime. So just be aware of that. And now you'll start looking at each other's earlobes, which is good. Let's examine just a few of these red flags as we go through various stages of our lives as women, because we've got this beautiful template of major changes that our bodies go through as we get older that provide clues to our future cardiovascular risk. So younger women, as they enter into puberty, a woman's age of monarch, which is the age for which she has her first menstrual period, is associated with an increased lifetime of cardiovascular risks, i.e., heart attacks and strokes. If a woman is under 10 years old when she starts her first menstrual period, her lifetime cardiovascular risk is increased by 27%. If over 17 years of age, the lifetime cardiovascular risk is increased by 23%. So that's something to be aware of, both for our children, grandchildren, nieces, etc. What about migraines, right? And vasomotor symptoms associated with perimenopause, like hot flashes, inability to sleep. Well, they've looked at that. Women between the ages of 18 and 30 with a history of migraine and persistent vasomotor symptoms, whether they be related to perimenopause or menopause, or even symptoms related to the migraine, these women showed a threefold increased risk of stroke throughout their lifetime and a 90% increased risk of stroke later in life, past age 75. Why is this? There's probably a lot of reasons. We don't know if it's the actual pathology of the migraine. Is it the fact that these women spend their lives not sleeping well? Is it the fact that women with migraines tend to have a high use of ibuprofen, which alone increases our risk of a stroke by 3.36 fold? So all of these reasons compound each other and give us these startling statistics. How about if we just check our pulse? 26% increased risk of a heart attack for all women, no matter what age, no matter what fitness level, who have a higher resting pulse rate above 76% or 76 beats per minute, have this 26% increase heart attack risk. It's highest among women ages 50 to 64. As I said, it's predictive of all ethnic groups, and it's independent of physical activity. inflammatory disease, 20% increased risk of cardiovascular disease throughout our lifetime. Women with inflammatory bowel disease have a higher cardiovascular risk compared to men at all ages across the board. Polycystic ovarian syndrome. Women with this condition are 3 times more likely to have heart disease. And here's a really fun fact. The brothers of these women who have polycystic ovarian syndrome have equal risk as their sisters, but they don't have the organ system in their body to tell them that they have this metabolic sort of syndrome going on behind the scenes. Polycystic ovarian syndrome, more commonly known as PCOS, affects the entire body through a lot of metabolic conditions, including ovarian cysts, including prediabetes, hormone fluctuations, conception challenges, all of the excess weight gain and trouble losing weight, all of which can increase our risk of things like type 2 diabetes, blood pressure, and concerns moving forward. And pregnancy, it's a stress on the body. So it's telling us a lot of important insights into our future cardiovascular risk. So let's look at a few of the symptoms that women can have during pregnancy that might make us think, I better ask my medical provider to do some workup so I know that I'm okay as I continue through life after the pregnancy. Gestational diabetes tells a really important story. Women who deal with gestational diabetes have a twofold increased risk of developing sustained type 2 diabetes later in their life. So it's almost not a matter of if I'm going to get diabetes later in life if I had gestational diabetes. It's almost a matter of when. And a 68% increased risk of heart disease. Both of those conditions, type 2 diabetes and heart disease, can and should be prevented. Gestational diabetes accounts for roughly 10 to 15% of pregnancies in the United States. What about preeclampsia? Preeclampsia is a medical emergency, and the only cure is to deliver the baby. That is the only cure. Symptoms of it include a blood pressure that can drastically rise in a very unsafe way, protein in the urine, swelling in the hands and the feet, sudden weight gain, vision changes, nausea, and they need to deliver that child to protect both mom and baby. Women who deal with preeclampsia during pregnancy, when the pregnancy is over and hopefully mom and baby are safe, oftentimes it's forgotten about. And it's one of those horrible moments, scary moments during pregnancy. But do you know when that woman is 10 years out from that pregnancy, the child hopefully is 10 years old. What would that be? Fourth grade, perhaps third, fourth, fifth grade. I guess third grade. Have a hard time remembering. But these women have a twofold increased risk of heart attack and stroke 10 years post-pregnancy. And they have a twofold increased risk of a venous blood clot in 4 to 5 years post-pregnancy. Matter of fact, it was stated since for about the last 10 years that if a woman dealt with preeclampsia during pregnancy, she needs a full cardiovascular workup 3 to 6 months after pregnancy, and it's rarely done. Rarely done. So if you had preeclampsia or someone you know did, make sure they get in for a full cardiovascular evaluation, and I'll show you what that means as we move through. So high blood pressure during pregnancy shows a 41% higher risk of heart attack and stroke. Menopause, as we continue through life, that we will spend almost half our life in menopause, about 40% of our lives in a post-menopausal state. And it's rarely talked about, and it should be shouted from the rooftops. It should be discussed because our bodies do change, our needs change, etc. Matter of fact, postmenopausal women have a 2 to 6-fold greater incidence of heart disease than premenopausal women. And the highest risk of this heart disease associated with menopause occurs when women go into menopause at a younger age. So women who are in menopause in their 40s have a higher risk than those who go into menopause in their 50s or 60s. So that's something to think about as well. So if someone is in menopause, this is a big hot topic. Are hormones a yay or a nay? Are they always okay or always not okay? And it's definitely a gray area. And the latest research is suggesting that hormone replacement therapy, when used appropriately, can reduce cardiovascular disease by 30 to even 50% when it's utilized at the appropriate time, usually before someone is 60 and within 10 years of menopause. And individualization of that hormone replacement therapy is best. And so it's something that needs to be handled between you and your healthcare provider. Topical forms, bioidentical forms are usually safer than oral routes of hormone replacement therapy. There's a lot of reasons to consider hormone replacement, but that's a discussion you have from your provider, and we can measure your safety, your inflammation as you go through menopause to know that it's okay to be on those hormones. So it's not a no or a yes. It's definitely a gray area. So as women get older, a lot of women become caregivers. Women tend to live longer than men. The average age for women in the US now is 81. However, it's growing because we're becoming more aware, we're taking care of ourselves, and we're aware of the importance of that earlier in life so that our last decade of life becomes a healthier situation. But a lot of women are caregivers. And women within that first 1 to 4 years of being a caregiver of somebody they love, it could be a child, it could be someone in the home with cancer, it could be their partner or spouse. But women within the first 1 to 4 years of taking on that caregiver role show a 17% increased risk of heart disease. And an interesting fact, as they continue that caregiving role, after 5 years, 36% increased risk of stroke. And after you've been a caregiver for over 5 years, that's a time when a lot of people forget what you're dealing with. The prayer chains might stop, the food support might stop. The idea of getting you to your medical checkups and appointments might not be as readily available. So really look after those women in your network who are caregivers because they need some love and support along the way as well. And then I wanted to bring up this whole issue that is so real and so tangible of social isolation. They really started to study it during COVID because it was such a drastic reality change. But as they continue to look at it, it's not just during COVID. Women who are lonely and socially isolated have up to a 27% higher risk of incident heart attacks, strokes, even after adjusting for health behaviors rather and health outcomes. Nearly 50% of women, around 10 million, over the age of 75 live alone. So if you have a neighbor, if you have a relative, if you have someone you care about, nurture that relationship because loneliness is a definite cardiovascular risk factor. Okay, so let's shift gears a little bit. We all look at those red flags and think, wow, I think I have some of those. Of no fault of my own. I just have some of those. So what do I do now? Like what if I had preeclampsia or gestational diabetes? I'm healthy now. What do I do? So let's talk about what to do about it. The first and most important thing is to understand what causes a cardiovascular event, i.e., a heart attack or an ischemic a stroke. What causes that? If we understand what causes it, we can make decisions to understand if we have one of those root causes. So, first and foremost, have you ever wondered why heart attacks are such a shock? Like, why is someone fine on Monday and not on Tuesday? Or fine at Thanksgiving, and come the Christmas, Hanukkah time holiday season, they're not okay. Did they not know that was coming? Oftentimes they don't. And I told you earlier that 64% of us have no idea that we're walking around with plaque in our arteries that could misbehave at any time. So here's the sneaky thing. Plaque is smart. It hides in the wall of our artery, virtually out of sight, out of mind. If you think about a garden hose, blood flow or the water flow in that garden hose is protected. The disease or plaque, or a fancy word is atherosclerosis, lives in the hose itself. So if we're looking through that hose and want to know if we have plaque, that's not where it presents itself. You don't feel it until you do. So what does that mean? Why would we feel it all of a sudden? And why is it such a surprise? I'm going to play for you a really short little illustration um, that kind of talks about this. But what happens is we develop plaque in the wall of the artery because our bodies are amazing. We are built to survive. So we will just tuck it away in the wall of the artery until we can't, or until there's an inflammatory cascade. It could be an abscessed tooth. It could be uncontrolled blood pressure. It could be all kinds of things that can cause that plaque that's safely tucked away to rupture through the artery wall. And our body is good at healing itself. If I get a cut, I'm going to form a scab. Well, if that plaque ruptures through the artery wall, our bodies heal it. And in that process of healing it, we form a clot. And that clot is what ultimately causes the blockage. So let me show you how this works and how quickly it can happen. And it happens like that. So that plaque in the artery wall is okay, safely tucked away, until it's not. And as I'm going through this, you may start to feel anxious, like, oh my gosh, well, how do I know if I have plaque, and can it be stopped? And the answer is we can find out if you have plaque very safely and very effectively and very cost effectively, and we can actually prevent it from doing this. It's a treatable condition. Okay, so if you get a clot and it lands in the arteries around the heart that feed nutrients around the heart, that is called a heart attack. If that clot lands in the brain somewhere, that is called a stroke. Oftentimes, it happens throughout our body. We have 30,000 miles of these arteries, as you see on the left side. And this sort of silent plaque rupture thrombus can happen in vessels that are no bigger than a human hair and lead to those diseases of aging that claim our independence, like dementia, blindness, kidney disease, all of these things that claim our independence. Okay, so if plaque hides in the artery wall, are there tests that can find it before someone has a blockage? It's a fair question, because if I have a hose and the hose itself is compromised, I want to know that before I have a problem. Okay, so that's a fair question. So yes, the answer is yes. There are a couple of tests that are readily available. They're safe and really effective. There's a lot of them, but a few that are just right at our fingertips. We just need to know what to ask for. Will my insurance cover them? Sadly, probably not, because most insurance companies are based on that end stage disease. So until you have symptoms, oftentimes testing to look for the health of that hose or the artery wall are not covered by insurance. Well, then I probably can't afford it. I mean, I know, um, so and so had a heart attack and they had a bypass and it cost them $500,000. I know that. My neighbor had a test and it cost $2,000 because she had symptoms and ended up in the cath lab. All of these tests are too expensive for me. The cost of getting one of these tests is roughly $50 to a high end of 300, depending on your location. And while that is a lot of money, you can choose to save it and you can choose to get one of these tests if you ask for it. So, a couple that are really accessible. One is called the carotid intima media thickness test, and it's appropriate for all ages because there's no exposure to radiation. And basically, we use the carotid arteries as a guide to what's going on in the rest of the body. And that's not an opinion. The data and the science supports that. So, what we can do with an ultrasound is peek into that artery system and see if there's plaque in the artery wall because the ultrasound beam is shooting outward at the wall of the artery. Very safe. And we know what normal is as far as arterial wall thickness, all the way down to infancy, to all the way up about age 85. So it's a beautiful tool. I don't want you to get confused with the fact that there are companies that go around. One is called Lifeline Screening. And while they do a good job on different types of things, they do not do a test that looks at the wall of the artery. They do a modified test that looks at blood flow. So you can have plaque in the wall of the artery and have a perfectly normal, what's called duplex scan, which looks at blood flow through that artery. So don't get confused on the two, they're different. Um, a coronary artery calcium scan, if women are over 50, that's a test that's really available all over the country. It runs as low as $50 and it looks, basically takes a picture of the arteries of the heart externally. So you get an image. It's a little bit challenging in that anything looking at CT scanning, or if you think about an X-ray, those tests can only tell us the hard stuff. You know, they tell us if something is hard, and in this case, it would be calcification, which is really a late stage of the disease because as the disease starts out, it isn't calcified yet. So if someone has a 0 coronary calcium score, they could still have some hidden plaque in the artery. So both tests are great, and I want you to be aware that they are available, cost effective, reproducible, validated. And matter of fact, the American Heart Association, since the year 2000, that was 25 years ago, has suggested that we all should get a carotid intima media thickness test, that everybody should. And since 2016, they've advocated that we can use a carotid intima media thickness test to follow the disease over time. So what a wonderful tool, but since it's not covered by insurance, a lot of people don't even know to ask for it. So I'm advocating that you be bold and you ask for the test that you need. So educate ourselves. What causes a heart attack or stroke? It's plaque rupture and a blood clot. Okay, we want to be aware that conditions that we live with, like migraines, menopause, early monarch, gestational diabetes, preeclampsia, loneliness, all of these factors increase our risk. And we need to take action. We need to do something about it. Number one, ask yourself, do you have plaque hiding in that artery wall? It's a very fair question. And then we need to differentiate between a red flag, meaning like Frank sign, as an example. We don't know why people with Frank sign have a 78% increased risk of having plaque in their arteries, but they do, right? There are certain things that definitely are causal of vascular disease or arterial disease. And I have this picture up because you can see those root causes underneath the tree, and there are many of them. Um, you see sleep on there and airway, you see insulin resistance, you see genetic factors like lipoprotein A and other genetic factors like 9p21. You see gut dysbiosis, you see periodontal disease, endodontic disease. You see all these conditions, and sadly, the current standard of care really only looks at three of them: cholesterol, blood pressure, and if you smoke, stop, or if you're exposed to nicotine at all, vaping, secondhand patches, nicotine, gum, whatever the case may be, nicotine does increase our risk. So those three factors are the ones that are dealt with, and I would argue fairly poorly, but those are recognized. And sadly, those may not be the issue for people. It may be all of these other root causes. And we have the science to back this up. So this was a paper that we wrote a couple years ago talking about all of these root causes and how do they really cause cholesterol plaquing in the artery wall. And it all stems from the artery wall is full of these healthy smooth muscle cells, and through any of these root causes it drives oxidative stress that changes that environment and drives plaque trapping or cholesterol trapping, breakdown, and all of a sudden atherosclerosis in the artery wall. So the science is there demonstrating that all of these have an equal play in the development of heart disease. With that being said, let's talk about just a few of them. Let's start with the most popular, cholesterol. Do you know that over 50% of women who have a heart attack have normal cholesterol levels? Shocker, isn't it? I want you to take note of three important cholesterol numbers I want you to be aware of. The first one is not looking at the individual numbers, but rather do a ratio. Take your total cholesterol and divide it by the HDL, which is the good cholesterol. H, think high, happy. Higher it is, oftentimes the better it is, not always. But that ratio, we want to keep it under 3. If it's not under 3 when you calculate it, that's something to be aware of and talk to your medical provider about, because it should be under 3. The other one is something called ApoB, which isn't part of your normal standard cholesterol panel, but it's about a $10 blood test. And ApoB, if I had to describe it, and I was serving a platter of, you're serving a platter of, let's say, a charcuterie board. And in this case, ApoB would be that platter, and all of the dangerous cholesterol particles, LDL, small dense LDL, lipoprotein A, all of the bad guys are on that platter. That ApoB is the most predictive lipid that we have. So understand what your ApoB is, and the goal is it should remain under 80. There's one more I want to tell you about, and you're going to hear about it a lot more because finally, after 20 years, people are talking about it. We've been measuring it for over 20 years, about 25 years now. It's a genetic factor. It's called lipoprotein A. You either have it or you don't. It's found on chromosome number 6, so ask to be checked for it. If you do have it, you need to get in the care of someone who understands the magnitude of that genetically inherited lipid abnormality. We talk about it a lot in both of our books. So those three lipid numbers, total cholesterol to HDL ratio, ApoB, and lipoprotein A, are the three big kids I want you to be aware of. Let's look at a few other root causes like autoimmune, psychosocial, high blood pressure, insulin resistance, and even airway and oral health. Let's talk about autoimmune for a minute. Do you know that women have a higher rate of autoimmune conditions compared to men? 78% compared to men. And even systemic lupus erythematosus is a 6-to-1 ratio, women to men. It really is quite remarkable. And let's talk about a few of them. Rheumatoid arthritis increases the risk of a heart attack 7-fold. Systemic lupus erythematosus triples the risk of a heart attack in a woman's lifetime. Severe psoriasis, 50% increased risk of cardiovascular disease through a woman's lifetime. Sjogren's more than doubles the risk of a heart attack. Crohn's disease increases risk of a heart attack by 24%. And Hashimoto's thyroiditis increases the risk of a heart attack by 50%. So what do we do? What action items should we be aware of? First and foremost, lifestyle is critical when someone is dealing with an autoimmune condition. Diet, avoiding the inflammatory foods, which often include gluten and sugar and dairy and alcohol. Following a nice, well-rounded diet with plenty of vegetables on board. Hydration, goal of 50 to 100 ounces of just good old-fashioned water every day, exercise, daily movement for at least 30 minutes. And it doesn't have to be running. It can be things like Zumba, Tai Chi, yoga, walking, biking, dancing, a rebounder, focusing on our grip strength. Just even standing for some people can be considered to be exercise, and all of that's fantastic. Dancing is so valuable for so many reasons. Laughter reduces inflammation. Saunas, both infrared and traditional, reduce inflammation. Mindfulness daily for 15 minutes reduces stress and anxiety, and i.e. inflammation. Adequate rest, respect the amount of sleep we need. People with autoimmune conditions need more rest, 8 to 10 hours on average versus 6 to 8. So be aware of this. Stay on your treatment. If you are under the care of an autoimmune specialist and they have you on disease modulating therapy, do not stop it, because those same therapies to reduce the attack on your body also reduce your cardiovascular risk. There's a lot of synergy. Let's talk about gut health. That's a big one. Gut health, gut dysbiosis dramatically increases systemic inflammation and arterial inflammation and oxidative stress. Some go-tos that are really important to protect our gut health: getting pre and probiotic foods, get adequate fiber in your diet, learn how to eat a balanced plate. And I'm going to advocate that all of us get Monica Jacobson's and Bria Seberg's cookbook called The Balanced Plate. Everything is naturally gluten-free. Everything is balanced. And especially if you have an autoimmune condition, have any of those red flags, you need to get this cookbook, and you need to use the recipes and also learn how to cook in a way that is very anti-inflammatory. So I have a huge respect for what Dr. Seberg and Monica Jacobson put together. It's really phenomenal. So thank you, ladies, for putting this together as a great resource for all of us. Let's talk about our mental health, shall we? First off, what is stress? I mean, everyone feels it in a different way. There's different stresses we all deal with. One person's stress may not equal the next, but the best definition is to be in an environment for which you perceive a lack of control. We all have different stressors, and we cannot often change that. If your work is causing you an angst about feeling a lack of control, the only way to handle that is to change our perception of control, because oftentimes we can't change our environment. So kind of keep that. It's why a fifth grader could be stressed about something that you may look at, or we may look at and say, that's nothing, just wait until. No, everyone's stress is real, and it's very damaging to the body if it's not managed properly. Anxiety, 50% higher risk of cardiac death. Post-traumatic stress disorder increases heart disease risk by 60% in women that were followed for over 20 years. Depression is associated with a twofold increased risk of stroke. So, what action items can we do? How do we reduce our emotional stress? Lots of ways. Yoga and meditation reduce aging and oxidative stress, loneliness, 29% increase risk of heart attack, and 32% increased risk of stroke. Optimism lowers our risk. Tai Chi lowers our risk. Women with self compassion, and I would argue empathy, have a decreased risk of heart attack and stroke. Ask yourself every day, is my mind just full or am I being mindful? It's a very important distinction. And counseling, I cannot say enough about the values of counseling and having that objective, proactive relationship with someone to work through stressors in your life. We know that counseling reduces our cardiovascular risk, and seek help. Should be very proud of that, if you have a good relationship with a counselor. Also, shameless plug for our dog Darby, um, because the data also stands true that pets improve cardiometabolic health. I would argue kitty cats do too, but I couldn't help putting our 13-year-old beautiful, smiling, always loving you when you get home lab, Darby. So thank you, Darby, for reducing our cardiovascular risk every time we come home. All right, let's talk about blood pressure for a minute. What's normal? I should say this. What's optimal? Normal optimal blood pressure should be less than 120 over 80. That's different from the old days of it should be less than 140 over 90. Remember that? If your blood pressure is consistently over 120 over 80, that's not okay because that damages the arteries, the little ones and the big ones. What about if I have a higher blood pressure just above 120 over 80 at age 53? Do you know that if our blood pressure at age 53 is around 120 over 80 or higher, this is associated with blood brain volume decrease and memory loss by the age of 70. So what we do in our 50s is extremely important to protect our brain health in our 70s, 80s, and 90s. So there's no age limit to the effect of high blood pressure. And that's important because if you look at one of the top reasons why people have diseases of aging and create that 13-year age disparity between health and life, think about blood pressure. If we protect our arteries and keep our blood pressure below that 120 mark, it protects our brain, our vision, our heart, our kidneys, our aneurysm risk, and even peripheral arterial disease risk. Very, very important that we pay attention to our blood pressure. Let's talk about that for a minute. I want you to realize it's really important to get your blood pressure in the morning. So make sure you have a blood pressure cuff at home, number one, and check it in the morning and start recording it. Wrist cuffs are fine for a screening tool. They're easy, they fit different family members because most wrist sizes fit in a traditional wrist cuff, whereas the brachial or you sometimes need a different cuff within a household. But just make sure when you do a wrist measurement, your feet are flat on the floor, they're not crossed, and you hold that cuff at heart level, and it can be successfully done. The goal remains under 120 over 80. And yes, we are made to run from tigers and bears and lions. So occasionally it's appropriate for it to go higher, but on the average, 120 over 80 or less is considered normal. What if our blood pressure is creeping up a little bit? Some things that we need to be aware of: movement, laughter, mindfulness, sleep, optimizing nutrients like vitamin D, monitoring sometimes our sodium intake, staying hydrated, vegetables, hibiscus tea, 3 8-ounce cups of hibiscus tea, lower that systolic, that top number, by on average 5 to 7 millimeters of mercury. That's beautiful. Beets lower blood pressure, antioxidant foods, even getting regular dental checkups lowers blood pressure. Sometimes pharmaceutical intervention is necessary if, with all of this, your blood pressure is still stubborn. So don't be afraid to treat blood pressure because the cascade in our 70s, 80s, and 90s is not the way we want it to be. Okay, we're marching through. We have just a couple more. Hang in there. Insulin resistance and diabetes. So 86 million people, more than 1 out of 3 adults, have pre-diabetes. 9 out of 10 of these individuals have no idea they're walking towards a diabetic situation. Why? Because our current healthcare system supports the idea that we don't get told we're pre-diabetic. We only get told we're diabetic. And that's 20 years of damage that goes by before we're told we're diabetic. And sadly, oftentimes the only thing treated are the blood sugars. This is a syndrome. 70% of people with heart disease have prediabetes, and 50% of stroke patients have prediabetes. It's often a 20-year path to become diabetes. It's a syndrome. It involves inflammation, oxidative stress, and it just silently just damages the arteries and the organs, the big ones and the little ones. How do you find pre-diabetes or insulin resistance? Do you just wait until your blood sugars are so high that they say, oh my gosh, you have diabetes? Matter of fact, you've had insulin resistance for 20 years. No. Ask for an annual oral glucose tolerance test. Ask to get a continuous glucose monitor. Monitor on your own what's going on after you eat and throughout the day and throughout the night. Know what your body is telling you. We are so used to biometrics. We are. They're available. They're at our fingertips. You can get these monitors over the counter. Oftentimes you can get your provider to write a prescription for one, but they're so easy and it's a beautiful tool, biofeedback, just like a blood pressure cuff, just like a scale, to know what your blood sugar is doing throughout our day, throughout our night. Don't wait for a diagnosis of diabetes to find out you've been damaging your arteries for 20 years. Just don't do it. Know your numbers. Insulin resistance, diabetes, and heart disease are the end results of this condition. Fasting blood sugar should always be under 100. A1C, which is a 3-month average, should stay under 5.7. Getting a 75-gram glucose tolerance test at 1 hour, our blood sugar should stay under 125. At 2 hours, our blood sugar should stay under 120. Same with on a glucose monitor. You eat dinner, your 1 hour sugar that monitor is telling you should be under 125, and your 2 hour should be under 120. If you are diabetic, keep tight glucose control. Don't let those numbers shift and don't become apathetic. Continuous glucose monitors are wonderful. Make sure you've experimented with one. It's a great tool. What can we do to reduce our risk of being diabetic? There are medicines which work phenomenally, but also lifestyle. Optimal lifestyle can reduce the risk of becoming diabetic by 75%. Keeping our waist measurement under 35 inches, move more, at least 30 inches, 30 minutes a day, sleep between 6 to 8 hours per night. Resistance training, muscle building improves the muscle cell's ability to use the insulin, therefore telling the beta cells that make it, hey guys, we've got you covered. So they don't get exhausted to the point that someone's diabetic. Sometimes keeping a narrow food window when it's appropriate is helpful. Diets that are robust in an anti-inflammatory sort of cascade, like Mediterranean, vegetables, good fats, limiting our carbs. Alcohol, there's no benefit to alcohol. We know that even 1 glass a day does increase our cancer risk, breast cancer, liver cancer, colorectal cancer. We know that alcohol is a sugar. So the idea that a little bit of alcohol is protecting us is really a misnomer. It doesn't mean you can't ever have it, but don't do it thinking it's protecting you. And I would advocate absolutely no soda, none, not diet and not regular, because they both increase our risk by around 50%. Prediabetes, metabolic syndrome, and diabetes. Just don't do it. Genetics, we have genetics that help guide our individual lifestyle advice. We use genes like the ApoE gene, and we use a gene called haptoglobin, which I don't have time to go into today, but they're in our book. So make sure and read about them. Certain supplements can reduce our risk, like berberine, turmeric, cinnamon, melatonin, vitamin K2, MK7, chromium, vitamin D, all can help with blood sugar management and insulin resistance, which is great. Last two, airway and sleep. Do you know that your dentist and your dental hygienist and your entire dental team are critical to reduce your heart attack and stroke risk? Dentists can identify by the way we grind our teeth, by the way our jaw is formed, that we might have sleep apnea. We can sleep quality, sleep quantity. Also in the dental office, having a tooth infection like endodontic disease, an old root canal that's gone bad, periodontal disease, getting that oral health balance. Let's talk about sleep. More than half of women in pre and post menopause have sleep issues. Untreated sleep apnea doubles the risk of a heart attack, stroke, and cardiovascular death. Poor sleep quality and quantity increases obesity, type 2 diabetes, and blood pressure. Adequate sleep is essential to reduce our vascular risk. It worsens all of those things and more that I talked about, including our quality of life. Measure your sleep, get an Aura ring. It's like a Fitbit on steroids for sleep. Sleep number beds tell us how we sleep. Watches, talk to your healthcare team about your sleep. Also, watch the kids. Our mouth breathers, really high risk for metabolic complications as we get older. Matter of fact, I should put that in our root causes. Watch for those little mouth breathing children because their risk is higher later in life for blood pressure, metabolic syndrome, obesity, diabetes. Sleep apnea. Do not be afraid to get tested. The home testing equipment is phenomenal. I think we all should get tested. And P.S., if your bed partner is keeping you awake, make sure and get him or her tested as well, because they aren't helping your quality of life and your cardiovascular risk either. Oral health is an essential piece of the puzzle for heart disease management and prevention. It's critical to control vascular inflammation. Mouth breathing isn't good. Hormone changes affect our gum inflammation throughout our entire lifespan. Oral optimal home care is critical. Electric toothbrushes, Sonicares, flossing, water pick, probiotic rinses, all those things. Listen to what your hygienist tells you because he or she knows what they're talking about. More frequent visits to your dental office. Get cleanings every 3 months, even if your insurance only covers every 6 months. If you can swing it, get in there more often. It's only going to improve your health long term. Ask about getting your pathogens tested. There's bacteria, and certain bacteria are really damaging. They increase our risk of Alzheimer's. They increase our risk of blood pressure and heart disease, stroke, and heart attack. So find out what bacteria live in our mouth and gum line. Really important. All right. So I'm going to close now. And I know that was a lot of information, but remember, all of these root causes under the tree, and we talked about just a few of them. So a few takeaways from them, 50% of us who have a heart attack have normal cholesterol. Normal blood pressure is under 120/80. Insulin resistance, we have 20 years to find it. Find it before you're diabetic. Get tested for sleep. Understand our psychosocial health matters. All of it matters. So just in review, as far as education, heart disease is our #1 cause of death, and it's preventable, 100%. Awareness, identify your red flags. We all have them. There's nothing to be ashamed about. Action, do you have plaque in your arteries? Is it sitting there waiting to misbehave? You can find out. Ask for these tests like a CIMT, carotid intima media thickness test, coronary calcium scan. Ask for them. Identify all the root causes and get them treated optimally. And remember, you are important. Read, get educated, ask for tests, share this information with others. That's how we're going to change these statistics. So what are your 3 facts that you learned today that you will share with 3 people tonight and 3 people over the next 3 days? After you do that, the rule of threes will happen and you'll remember these certain things and it becomes just conversation. That's all. Resources to learn more. Brad Bale and I have these two books, Beat the Heart Attack Gene, Healthy Heart, Healthy Brain, which are available at all Barnes and Nobles, on Amazon.com, and also at your local bookstores. Healthy Heart, Healthy Brain really addresses the systemic nature of arterial disease, and looks at it across the age span, and it's readable. Both of them are readable to the public. You don't have to have a medical background for these. They're written for the public. And then Dr. Seberg and Monica Jacobson's cookbook, The Balanced Plate, is extremely important as an anti-inflammatory resource as well. Get it, and that's on Amazon.com. You can find me here every day. I own and operate the Prevention Center for Heart and Brain Health in Spokane, Washington. This is my amazing team and my amazing colleagues. Dr. Bradley, yes, Dr. Bradley Bale. He doesn't work with me physically here, but we work together on Bale Doneen, obviously. Here in the office seeing patients, we have Dr. Pierre Leimgruber, we have Dr. Bria Seberg, we have Monica Jacobson, registered nutritionalist and dietitian, who's amazing. We have an incredible team of educated and compassionate nurses and everyone from the front office to the back office. We're here for you, and that's our contact information. There's several avenues where you can get a Bale Doneen assessment. You can come see me and my team at the Prevention Center, as you see listed. Dr. Bale's associate, Dr. Charles Wilnauer, is in Kansas City, and you can reach Dr. Bale and Dr. Wilnauer at bwoodcock@baledoneen.com. Bale Doneen has a full telehealth program that's available at all state levels, all 50 states. Go to baledoneen.com, find out about it, and get a evaluation. And you can also find Bale Doneen trained providers in your own area at baledoneen.com. So we're here for you, and we're here to help you. So I think I went about 30 seconds over, and for that, I hope you all stayed on the line. I know we do not have time for questions on this talk, but feel free to reach out. We're here for you. Get the resources, and the whole goal of tonight is to just leave this meeting healthier than before when you stepped in, and that just starts with awareness. And share 3 facts with yourself and others. So my love to all of you, and I wish you all the most optimal health throughout your lifetime. Thank you so much.